Welcome everybody tonight. I'm really excited. This is awesome. And I'm excited that we've got a lot of people with us on the webinar tonight, and I really applaud you for joining us, and I think you're going to find this very interesting. And it's kind of fun for me because I get to talk about something just besides dental caries for a moment, but actually I'm going to talk about dental caries a little bit tonight too as it relates to what's happening in the environment around us as well. But tonight I want to introduce to you, we've been working on this for almost 2 years as a team, and so we were hoping to introduce this last fall, but we've taken our time to make sure that we had dotted all our I's and crossed all our T's. So this day couldn't come soon enough for me, and I'm very excited to share this with you. Compass is a dental benefit membership plan. It's an alternative to dental insurance for your patients. And so we want to start with that tonight. And what I really want to talk about is climate change, and not global warming or climate change globally, but I want to talk about what's going on in the dental profession right at the moment. There are a lot of things that are happening in the profession and in terms of providers and payments and the government involvement as well. And of course, we're all aware of Obamacare, the Affordable Care Act. There were some promises made with that plan that certainly haven't lived up to what all of our expectations were, and there's certainly been some challenges implementing it, and the website and all of those issues. But there's a lot of impact that this is potentially going to have on dental practices. And so when I started looking at this law a couple of years ago, the alarms went off, and I thought we need to be able to respond and help practices to be able to kind of navigate our way through this, because the things that are happening in our profession right at the moment, there's a declining utilization of dental care by all adults. The total number of adult appointments in general practice right now is on a steady decline. There's continued financial pressure on employers. Now, the employer mandate has been delayed until this fall, but it's at the point in time where things aren't continued to be delayed, and the Affordable Care Act is implemented and continues to be implemented fully. It's going to put a tremendous amount of pressure on employers. They have to provide medical insurance for their employees, but that doesn't include dental. So if the patient is 21 years or younger, it includes dental. The family is required to make sure that their children have dental insurance, but employers are not going to be required to provide dental insurance. So one of the things that I'm already seeing happening in my community, a couple of the larger employers have actually completely dropped dental insurance, dental coverage, so that they can continue to be able to afford to provide the medical insurance with the rising costs of the premiums in healthcare. So it's going to be a lot of pressure on you and I as providers to be more efficient. There's going to be a lot more integration between delivery of healthcare and financing. I think we're all kind of aware of, where our patients are at. The economic environment in the United States has been challenging for everybody for the last 5 years, and so I know that my patients aren't a lot different from your patients. They struggle, financially, trying to figure out how to afford things that they need, afford the dentistry that they need as well. And we're seeing, increased consumerism in dentistry. People are shopping more. We get people calling every day, and I know that you do as well. And so, people are looking for a bargain. One of the challenges that we have, a lot of patients, a lot of the public perceives dentistry as a commodity. A dentist is a dentist is a dentist, so let me call and get the cheapest one, and I'm going to get the same care and expertise and service. And we all know that that's not necessarily the case. And so if we look at some data here, we peaked for adult visits in general practice in the United States in 2002, and that's the blue line on the chart. And it's been steadily declining, and it's going to probably continue to decline, particularly as people lose their dental insurance. The children visits to the dentist, it's been kind of going up and down, fluctuating, but it seems to be fairly stable. But it's the adult part of the population that I'm most concerned about. And if you look at dentistry as a whole, from 1990 to 2002, we were actually growing faster than all of the rest of healthcare. And, from 2002, we peaked, and then to 2008, we actually, declined and are growing slower than healthcare is in general. In the last 5 years, 6 years now, we're actually in a negative growth. We're actually on a decline. The total amount of revenue dollars that are spent on dentistry in the United States is declining. It's not growing. And so certainly that has an impact on all of you and I as practitioners as well. If we look at the utilization of appointments in dental practices, for dental care, particularly with adults, this survey was published in JADA back in February of this year, and they looked at 2,166 adults over the age of 65 in this survey, and they found that key elements were being female and married and not being poor and having a higher education level and having private dental insurance were associated with higher odds of that person having utilized dental care or having a dental appointment in the previous 12 months. And patients that lived in a community that actually had a higher dentist to population ratio were also more likely to use dental services. So you start thinking about men don't have dental insurance, maybe aren't educated, don't have a higher education, less likely to utilize our services. And particularly the one that concerns me the most is whether or not they have dental insurance and will they utilize it. So we know that that's changing. One of the other key indicators that we have too is we're seeing a growth in emergency room visits for dentistry. And of course, the Affordable Care Act was supposed to reduce the amount of emergency visits and probably provide a better triage of patients, because the emergency room visit is the most expensive delivery of health care that we have in the United States. And yet there's a tremendous amount of emergency dental visits that go seek care at the emergency room because they don't have other access to dental care. And actually, when we look at the statistics on that, and this comes from back in 2009, 30% of the people utilizing the emergency room for dental care are Medicaid. 40% of them are uninsured. And so you're looking at like 75% of these visits are people that currently have access to care, don't have dental insurance. And so, their access is through the emergency room. If we look at these statistics, and these come from Delta Dental Insurance, and they're a couple of years old, but it's pretty alarming when you really understand what this data means. In 2002, 60% of patients in the United States had, of the population, 60% of the population had dental insurance. As of 2010, it was 57%, and as of 2014, it's down to 54%, and it's on the decline. And one of the things that we also know is that the people signing up for these federal and state exchanges on the Affordable Care Act, 86% of them are opting not to have dental insurance in that coverage. And so I know that you're probably experiencing some of these things yourself in your own practice, but other data that we have from Delta Dental is that we know if a patient has dental insurance, 81% of them see a dentist twice a year. Patients that are not insured in the United States, only 34% of them see the dentist twice a year. And by survey, 44% of them cite lack of insurance. The number one reason they cite by survey why they didn't see a dentist. Number two was that it was too expensive. So, those kind of tie those two thoughts together. But the statistics here are, let me back up here for a second. The statistics are, if your patient has dental insurance, 81% of them come in twice a year. For your patients who don't have dental insurance, only 34% of them come in twice a year to see your practice. So one of the things that, we're most concerned about is seeing, as people lose their dental insurance through their employer, seeing them shift from being in that 81% group down into that 34% group. And if you, if even 10% of your patients lose their practice, and, you take a 10% reduction in your hygiene visits, and I've already talked to practices in the state of Washington that are seeing basically downturns in their recall systems within their practices. So this is something I think that it is important for all of us to be on top of. So when you look at that, what I'm really concerned, the pie on the left, they're in that pool of 81% of the people that come in twice a year. It's going to get shifted down to only 34% of them will come in twice a year if they lose their dental insurance. So we need to have an option, other things available to them so that they can afford and have access to care. Another interesting survey I want to share with you, this one was done back in 2012, and the ADA duplicated it in 2013. But they were asked, if your employer stopped providing your dental insurance, would you buy it yourself? And it's very interesting that almost the exact percentage of people that currently have dental insurance, it was about 57%, said it was likely or very likely that they would buy insurance on their own. So people that have dental insurance place a very high value on having some kind of coverage because they feel like they can afford to go have their dental visit. And then I thought it was also interesting, too, they asked them, if you were going to go purchase it on your own, what kind of coverage, what would be important to you? And the thing that was most important, 75% of them were looking for a preventive plan. You know, it's nice to have all of the coverage, higher price, you know, the deluxe plan. But the majority of them, if I lost my dental insurance today, it's important for me to also have it. But I'm really focused on is I really want to make sure I have coverage for preventive procedures. So when we look at those kind of factors that are in the dental climate today, and then let me add this one as well, on top of this, you know, we're dealing with dental caries as the #1 disease in the world. It's literally the #1 disease in every country in the world. It's literally the #1 disease in every age bracket in every country. I mean, it's almost universally the largest disease burden on the planet. And so, you know, here in the United States, you know, we're dealing with an increasing decay rate in our 0 to 5-year-old children. We know that that's pretty predictive of what their decay experience is going to be like at least through their first half of life, based on, you know, studies population studies that we have on that evidence. And so this is an alarming trend. It's happening here in the United States as well as everywhere else. So we've got an increase of dental caries. We're going to have an increased demand for care, but there's going to be, if we lose or continue to see decline in dental insurance in the United States, you know, we're going to see declining access for people to get to that care. You know, so it's the most common disease. We need to figure out a way to help them navigate through the Affordable Care Act, both practices and patients. So as we talk about this, Ashley's going to, in a second here, going to, you know, share with you the Compass Plan and how it works, and, you know, what the benefits are to you as a practice and what the benefits are to the patient. But you know, I just want to share this with you. You know, I look at this and think, you know, why would you do this? You know, as a dental practitioner, you know, why would you offer a dental membership, you know, benefit plan in your practice? And I tell you, there are 2 reasons. And I know that we always like to think we are focused as a profession. I mean, we are focused on new patients. It's like, I want more new patients. I want more new patients. Yes, and I have to tell you, this is an opportunity to attract more new patients to your practice, and it's going to provide access for people to care in your practice that maybe didn't feel they had access before. You know, a lot of times our perception becomes our reality. They think they can't afford to come see you, so their reality is they can't afford to come see you, and so they don't. Where, you know, where they may really be able to afford to come see you, but what this really does, a membership plan helps make it affordable so that they can come and get access to come see you. So #1, a reason to do this is for, you know, a new patient and growth of your practice. And #2, and this is, I think, the most important reason of all, is if and when your patients begin losing some of their dental insurance, and I'm sure that you've already had these conversations with patients and they've asked you, what do I do, what do I do? I'm having these conversations almost every day in my practice, and I know that you probably are as well. And I've got patients retiring, or they graduated from college, they're no longer on their parents' insurance. So you've got all of these different issues on how they suddenly may have found themselves without coverage, or maybe they've never had coverage. But the most important part for me is, and I got to tell you, it was a patient I saw just the last patient I saw before I came over here to do this webinar. She and her husband have been in my practice for over 30 years. They're wonderful people. He's been dealing with terminal cancer now for 2 years. They've given him, you know, literally weeks to live. At this point in time, he's in remission. Nobody understands how or why that is. But they've been paying $1,500 a month for their health care benefits, and she said, this is my last appointment with you. I just can't afford to do this. I can't afford to come see you. I don't want to leave, but neither one of us want to leave your practice, but I don't know what else to do. and we're dropping all of our insurances. And you know, with you know, his cancer, he's doing well, but you know, I've retired to help take care of him. He was forced to retire, and so we're going to be losing a lot of our benefits. In fact, you know, I'm down on Thursday. You know, do everything you can for me today. And so I sat down with this patient, and I got out a Compass brochure, and I said, you know, this probably makes really good sense for both you and your husband, and you could stay in my practice. And when she looked at the benefits and she looked at the cost, she's going home to discuss it with her husband, but they don't want to leave my practice, and this is something that's going to give them access and maintain them in my practice. So rather than lose some of these patients or have them stop seeing you in the next 4 or 5 years as we go through this transition in our healthcare environment, here's an opportunity for you to retain your patients who have been with you for a very long time. So with that, I want to turn this over to Ashley, but there's 2 reasons to do this. One is to open your front door and, you know, invite more patients to come see you, and one is to close the back door and help protect and take care of the people that have been with you for a long time. So Ashley, tell us how we do this.
Great, thank you. So let me make sure I got the computer controls back. Okay, so I'm just going to do a quick walkthrough of our Compass program and how it works. And thank you, that was just a great example of the type of patient that we have in mind for this program, as well as others. Our goal with Compass is that we are putting the patient and the practice back in control. So these are membership programs that are directly between you and your patient. It's not between your patient and the insurance company and you. It's directly between you guys. Kind of just a comparison to think about it. So just in general, a gym membership, it's the type of place that you would have a monthly payment, and that's going to give you access to the gym equipment. As a benefit to being a member, you might also get a discount on some of the things they sell there, like supplements or personal training sessions, tanning, and then maybe even as a member, you get a benefit of some type of freebies, which could be a personal training session. Let's compare that to Compass. So kind of the same idea. Your patient is going to be a member of your practice. So they're going to make a monthly payment, and what that's going to give them is just some of the basic services that you're already providing. Professional cleanings, exams, x-rays, an emergency exam if needed, and then similar to kind of that gym membership would be benefits. So as a Compass member at your practice, they also receive a 15% discount on other dental services, which might be things like cosmetic work, and then a free smile consultation, which really for you is a great opportunity to talk to your patient about maybe treatment planning that they've been putting off that they can now combine with this member discount that they have. Here's just a quick look at the plans that we do have. We have 5 options. These are our 3 main ones. So we have our treatment membership, which is essentially just delivering products to your patient's door. Prescription products that you're actually going to choose for them. What we have next is our service membership, and what that is very similar to what you're already doing and kind of the example I just went through. So your patient would just have these basic services that they're going to receive, and what they're going to do is pay monthly opposed to paying at the time of that appointment. Our health membership is a combination of these 2, so the services that you provide as well as the products delivered straight to their door. The 2 other plans that we have are very similar. These are our perio ones. So these really, the only difference would be that the patient is going to be coming in more times. So we have that they would come in for cleanings 3 to 4 times a year, opposed to 1 to 2 times, which is what we have with the other plans. So let's just talk about some of the basics of how this works. So the best part about Compass is that you're making some of these decisions on how it will work in your practice. So we have those 5 plans. We also have 5 price levels for you to choose from. So you could kind of look at the prices that you already have and choose whether you wanted to be at the higher or lower end of that. You can also choose what plans you offer. So you might decide that out of those 5, you only want to offer 1 of them, 3 of them, maybe all of them. We also have you guys set exclusions for any of the things you want to leave off the discount. So you might decide that certain services aren't eligible for that 15% off. One of the biggest differences between standard dental insurance and these Compass plans is that there isn't any third-party influence, especially from us. So we don't need to know when the patient comes in or what services it is that they receive. They're a member with you guys and they have a Compass plan and they are set from there. you can kind of see on the screen here some of the things that we take care of as a company. So we're taking care of those basic behind the scenes. You kind of continue providing the same great services to your patient, and everything else just happens. The payments for your patient are set up automatically and processed by us. And then what we do on the 15th of each month is send you a payment for the patients you have signed up. If any of your patients are signed up for the health plan or the treatment plan that includes the optional products, those actually go out to your patient quarterly as well on an automatic basis. The first time they sign up, you do prescribe it, but after that, it just happens automatically. You know, Dr. Cooch kind of touched on this a little bit. You might be asking yourself why you would offer Compass plans to your patients. In addition to, you know, just providing a way for your patients to access these benefits, you're going to be receiving additional monthly revenue, increased case acceptance by providing this kind of special members-only discount. And then you also now have another great option for marketing to new and existing patients, especially those without insurance, or as Dr. Cooch mentioned, patients that maybe have it but know that they're going to be losing it relatively soon. So getting started with Compass is very simple, and it really only takes a couple of minutes. So what you would do first is visit our website, create an account, and sign up. Once you have created a provider account, we actually have a custom web page that is automatically generated for you. And on that page, it's going to be specific to your practice and show your name as well as the pricing level you chose and the plans that you're going to offer. In your account, there's also a code generated so that you can easily get that button installed on your website, which is our next step here. And then basically once that's done, you are ready to begin signing up patients. What I'm actually going to do now is just kind of show you guys that process on our site. So if you visit compassdentist.com, up in the right-hand corner, we have this little Become a Provider text, and you would just click on that. And that's actually going to take you to our provider homepage. This is kind of the base where you would go and find all the information about being a provider. And then you'll just click this Create Account button, and that will take you to the next area where you're just going to be giving us some basic information. One thing I do want to note is that to see any of our pricing and plans, you do have to create an account, but this in no way makes you a provider or obligated to continue any further. We're just gathering some basic information here, practice name, contact information. This is also the information that would be displayed for patients if you do choose to become a provider in the future. The next step is the plans and pricing. So kind of how I mentioned already that you would be able to, whoops, I think I went one too far. There we go. You'd be able to go through and review the 5 different levels of pricing we have as well as the plans and kind of uncheck from here what it is that you want to offer. And then kind of the last step before you become a provider is just creating a profile for the contact person for your practice so that if patients did find you on our website, on our Find a Provider page, they would know who to contact, excuse me. And then once you go on from here, you're actually a provider on compassdentist.com. This page here is actually the first page that you would see when you create an account, and you can see kind of down in this bottom middle area that it has a reminder to install the button on your website. This is a little look of what it looks like. This is going to be the easiest way for your patients to sign up outside of your practice. Of course, in the practice, it would be very simple for you to enroll them, but if they need to go home and talk with their spouse or just kind of review the options, they'll be able to easily just go to your website. And that's actually what I want to show you is a couple examples right here of providers. So this is Dr. Lawrence down in California, and you can see she has the button installed on her website on the left-hand side there. And then we have Dr. Coleman up in Washington, and he shows we have a couple different options for the buttons, and he installed his there. For marketing, so in addition to installing that button, we do have some different things once you have that up that we would send you guys. We have some various brochures that you can put in your waiting room, some customizable letters that you could send to your existing patients, as well as a press release that we can send out, and those often get picked up by a local newspaper and can create some really good opportunities. Now, you know, once you're signed up to become a Compass provider, your only job is really letting your patients know about this new service you're offering, and we are going to do the rest from there. So from here, after this webinar, what we would recommend that you guys do is create an account and review those pricing options that we have there. We are going to provide a recording to, you guys can review it yourself if you have other team members you would like to watch it. We also do have some great videos on our website that provide similar information to this webinar, but that might be good to review, as well as our FAQ page on the site. There's tons of questions on there. And certainly if you guys have any questions, you can give us a call or send us an email. We do have some questions that have been coming in during the webinar that I'm going to just go over a few of those really quick. Let's see. First one, who would be the recipient of the monthly payment? That's a great question. So like I had said before, everything is happening automatically. So your patient is actually creating an account with us, and the payment is going to come directly to us. So you won't be managing their Compass account payment necessarily. You will be able to kind of have an area where you see the patients that you have signed up, but we will take care of all of the managing payments and then sending you the payments as well. Let's see, here's another question. What is the fee schedule that we provide? We actually do not provide a fee schedule. So kind of along the same lines that we are not insurance, we are an alternative essentially. So we don't provide you any rules as far as what you would charge. You know, your patient is paying for a plan that gives them those basic services, but outside of that, we would certainly recommend you use whatever fees you've been using before, whatever you're comfortable with. And then kind of going along with that, how does the patient sign up? I think we kind of went through that a little bit, but I did want to mention for you guys, if you have a patient in office, how you would sign them up. There's a few different ways. Once you're a provider, you have an account area where you can click enroll a patient, and it takes you through a very similar process that the patient goes through. You would be gathering similar information to what you use when you make your account, such as their address, name, creating a username and password, and then choosing the plan that they would like to get and filling out, you know, credit card and billing information to them. Let's see here. Another question is what happens if a patient cancels? We do have a cancellation fee if a patient cancels within the first 6 months. That is just to protect the practice, you know, from a patient not signing up, having an appointment, and canceling right away. So in the first 6 months, there is a fee of $200 if the patient cancels. After that, they are able to cancel at any time if they would like, but they actually can't cancel themselves. It does send a request to you. The idea there would be kind of providing the provider an opportunity not only to know that the patient wants to cancel, but have a conversation maybe to see why. You know, maybe they just want to choose a different option, different plan, and would like to continue being a member.
Ashley, that brings up a really interesting. It brings up an interesting point. I'm sitting here. These are great questions, by the way.
Yeah.
One of my thoughts is, you know, what happens if the patient cancels? What happens if the patient doesn't show up for their second recall visit? You know, that they had purchased, you know, in the plan. It's their benefit. They get to come in twice a year. What if they only come in once during the year and then don't show up?
That's a great question. So essentially, once they're a member, they have these benefits, but they are a little bit on their own with making sure that they use them. So a practice might choose to go about calling these patients or contacting them, sending them postcards as usual. But if a patient does not come in, they are still going to be paying those fees. And you know, you guys certainly would not have to let us know if they did or did not come in. But they will still be paying the fee and still be a member until they request that cancellation.
So the patient is, you know, it's kind of like a gym membership. You pay for it. If you show up and use it, great. If you don't show up, the gym still gets paid.
Exactly. And we think people will use these a lot more than gym memberships.
Well, I think, yeah, well, you know, the interesting thing as a practitioner, you know, I mean, the thing for me here is, you know, if my patient had dental insurance and they don't show up to see me, the insurance company gets paid, right? They're still making money. They're getting the money. In this situation, you know, I get the money instead, right? I benefit instead of the insurance company. I'm thinking, why should the insurance company always be the ones that are making all the money? So, you know, it provides an opportunity for us if the patient doesn't show up. Well, you know, that goes to the practice who's managing this, providing the service, giving the patients a discount. You know, it goes to the practice, not to some third-party insurance company that, you know, anyway.
Yes, that's a great point. Great point. The patient's still paying for their membership, and you will still be receiving that part of the membership every month from them. Let's see. And then I just have, I think I went over this already, but just one other question I do want to make sure. We had a question, what other fees does the dentist pay? So, of course, what the patient pays per month, there is a small portion of that that we keep for just kind of administering this account when we send the rest of it to you. But there are no other fees that you would be sending to us. You will not be having to give us a credit card, send us a check for anything else like that. And as I mentioned, the best way to kind of review the pricing structure and how that works would be to make an account. That way you're able to see kind of the interactive area that we have set up there where you can go through each of the 5 levels. I think that's all the questions we're going to get to. Dr. Fuchs, I don't know if you have anything else that you wanted to touch on or any other questions you can think of.
I would just tell you that I think it's really important to put the widget, the button on the Compass button on your website. I really strongly encourage you to do that because a lot of new patients looking at your website, I've had a number of new patients come to my practice and actually had signed up for the Compass on my website and then came to see me. So I think that you're really missing an important marketing opportunity for your practice if you don't, and it's a simple thing to go through the steps, but if you don't include that on your website, I think you're really missing out. So I'd encourage you to do that. I think that's really important.
Yeah, great point. Well, with that, oh, I'm sorry, go ahead.
No, I mean, actually, I think you did a wonderful job, and I think certainly, hopefully, we've given everybody the kind of information tonight on certainly raising their level of awareness about what's happening in the dental market, what's going to happen here in the next 2 or 3 years, and the impact, potentially from, just the economic environment and the Affordable Care Act. And I think you did a wonderful job of describing Compass and what it does and how they can benefit from it. So, thank you, Ashley.
Thank you. And certainly we'll be available. We have our offices open Monday through Friday. If anyone needs to call or wants to chat a little bit more about how this would work, we'd love to talk with you.
All right. Well, thank you, everybody, and have a wonderful evening. And I hope that you all take advantage of the opportunity to help your patients out by offering them an alternative to their dental insurance plans. Thank you.
Yeah. Thank you.